Hi guys, hope you're doing great. Hope I'm audible and visible to you. I just need your quick response in the chat box as quick as possible. So because the screen in front of me is quite new to me, the softwares and everything. So I just need your support and response as quick as possible so that we'll start the discussion as early as possible. Hope I'm audible and visible. Okay, please make sure. I want you to come to live. Okay. So please drag the cursor, come to live. I want you to comment S. I got responses from Pratyusha, Aditya, Aarti. Hi Aarti, Chandana is there. Francis is there. So please guys, please respond as quick as possible. So without any lag, we'll try to start this today's discussion part. So before we start today's discussion part, I hope like most of us are aware of NEET blueprint. So if you don't know, so please, this is NEET blueprint, which is given by NBE people. So NBE people has clearly given the NEET blueprint. So I hope you know the exam pattern. So the exam is going to be for 200 and just a second. Yeah, the exam is for 240 questions, which is for 3 hours, and it is being split into part A and part B. And part A, which includes all your first year, second year, and third year subjects without oral path and dental materials, okay, is going to come under your part A, which is going to be for 100 MCQs, okay, and a time duration of 75 minutes. So first 75 minutes, you'll get access to all these 100 questions. And coming to the question patterning, general anatomy with embryo and histo is carrying 14 marks. Physio and biochemistry are going to carry 14. Dental anatomy, dental histology is going to carry 14. General path, micro 14. Pharmacology 14. General medicine and general surgery together 15 plus 15. Okay, so this is where I'm going to end my part A. So after submitting part A, after 75 minutes, your part B will get opened. So this includes all the final year subjects along with DM and your oral pathology. Okay. Okay. So all other final year subjects, total 8, so total 10. So it's 8 plus 2. Okay. Each is going to carry 14. So 10 into 14 is 140 MCQs, and the time duration is 105 minutes. The time duration, the leftover is 105 minutes. Clear. I hope this is very, very clear. Okay. So I hope this is very, very clear. So you can drop your email address, okay, on the comment session, so that we'll be sending you the hard copy of the entire discussion of today's. Okay, right. I hope you guys are clear. So now I'm jumping into the first and foremost update from the team MDS Conquerors. We are having a midterm batch, which is going to start from September 21st. People who are interested can call us, interact with us. Okay. So after discussion, Okay, so we can plan your preparation with a customized schedule rather than an open schedule. Open schedule will be there for all of the students, but if you want to have a customized schedule basing upon your requirements and your categories you fall under, your commitments you have, the timeline you have, so we are going to give a customized schedule basing upon the target along with the open schedule you're going to have. So September 21st, so we have a week more the proceedings to start. So people who want info regarding this can drop a message on the comment box and you will be getting the required information. And coming to today's main part is today we have a GT, and regularly we have a GT discussion. So as per the request of few students, we thought of conducting this GT discussion part, not complete GT. Part B is already done in the morning session by Pritisha ma'am. So I have taken the privilege of teaching part A. In this GT, the part A is including biochemistry and dental anatomy. Okay, so I said part A is for 100 MCQs, similarly to the final exam pattern. So part A is for 100 MCQs, each MCQ carrying 44 marks, and for a time duration of 75 minutes. Okay, so in this we'll be discussing the questions along with the related concepts, and I'll try to analyze the question paper. Okay, right? So I hope you're all set. Can we start? I just need your quick response. All set, all fine, all clear. So without wasting any time, let's start the question answer pattern. Okay, so first of all, question number one. First of all, the question number one. Okay, so question number one is in front of you. Whenever you have a case-based question, I clearly told you to identify the keywords in the question. Okay, then you can go with the answer. Okay, so now the question is, a 2-year-old infant is brought for a routine well baby visit, and upon which the parents reported the child is having a musty smell urine. So urine is a musty smell, and has been experiencing frequent vomiting. On examination, the infant has a fair skin, blonde hair, and a blue eyes, which are unusual for the family dark complexion. The developmental milestones appears to be slightly delayed. The disorder is caused by the deficiency of the enzyme phenylalanine hydrolase. So this already we have discussed about this particular disease, that is PKU. PKU is mainly responsible for this. Whenever there is a deficiency of this particular enzyme, there will be heavy accumulation. There will be heavy accumulation of phenylalanine. Okay, so straightforward, the answer is option B. Okay, but I want to discuss a very important concept regarding this. Okay, so what is this concept? Already discussed. Okay, so again I want to recap it. So I'll be talking about the catecholamine synthesis. I hope you can see my screen. So catecholamine synthesis is a very important concept where your questions will be moving. Even if you take this particular exam question paper that's being prepared by one of the popular paper setter. Okay, right? So if you have so many questions on this catecholamine synthesis. Okay, so catecholamine synthesis basically starts with phenylalanine. You see phenylalanine, what it is doing? It is being converting into L-thyroxine, and we know that the thyroxine is an amino acid. So this process requires an enzyme called as phenylalanine hydrolase, and this process requires a coenzyme called as BH4. BH4 is very important. BH4 is nothing but called as tetrahydrobiopterin. Okay, so this BH4 is acting as a coenzyme, and it is activating this phenylalanine hydrolase reaction, by which the phenylalanine is converting into thyroxine. Okay, thyroxine, we know that thyroxine has many products as an impact, like all your T3, T4, everything are basically formed from thyroxine. Okay, so thyroxine, upon one more hydrolation in the presence of thyroxinase hydrolase, it is converting into L-dopa. It is converting into L-dopa again in the presence of BH4. So BH4 is required here. BH4 is required here. Okay, so now I have L-dopa in my hand. So now L-dopa in the presence of decarboxylase. Okay, aromatic amino acid decarboxylates, L-dopa is being converted into dopamine. Dopamine upon hydroxylation is converting into non-epinephrine. Non-epinephrine upon methylation, okay, N-methylation. Non-epinephrine upon N-methylation, because nor, you can remember no. There is no methyl group here, but you have methyl group in epinephrine. The difference between the structural difference between epinephrine and norepinephrine is no methyl group in norepinephrine and methyl group will be present in epinephrine, and that methyl group is obtained by methyl transferase. Okay, that methyl group is obtained by methyl transferase, and who is providing this methyl group? This methyl group is providing by SAM. This SAM is donating the methyl group for the compound which is having no methyl group to produce a compound which is having methyl group, that by which your non-epinephrine is being converted into epinephrine by methyl transferase. That methyl transferase is being produced by SAM. Okay. Now, during catecholamine synthesis, what are the vitamins which are involved is a very frequently asked question. So many times repeated for our NEET PG. It was repeated for NEET PG. So what are the vitamins which are associated? One is B6 and second one is vitamin C. Exactly where they are involved, you can easily remember. Decarboxylation is mainly mediated by B6, that most of us are aware. You can remember hydrolation here. Okay, is nothing but C. C contains water. Okay, hydra is water. C. The word C will tell you vitamin C. Okay, so both vitamin B6 and vitamin C are involved in catecholamine synthesis. Okay, I hope you got some questions in your mind. Okay, so you got some questions in your mind, so please do check it. Okay, the things to be noted are, okay, so what is the reaction that is happening to convert a non-epinephrine to epinephrine? The answer is methylation. Who is providing this methylation? The answer is SAM. What type of methylation it is? It is a O methylation or N methylation? Clearly mentioned, it is N methylation. It is N methylation. Okay, right? So I hope you guys are very clear with all the sequence of catecholamine synthesis I have discussed. So now I'm mainly focusing on this chart. So phenylalanine is there. In the presence of phenylalanine hydrolase and BH4, it is converting to thyroxine. Okay, in the presence of BH4, it is being converted into DOPA. DOPA in the presence of thyroxinase, it's going to convert into melanin. Whenever there is a damage to this particular enzyme, that leads to a condition called as albuminism. Melanin, melanin is going to give color to our skin. Okay, melanin is going to give color to our skin. Melanin will talk about the color of our skin. Now what is going to happen? Now I'm having DOPA. DOPA is being converted into dopamine in the presence of B6 decarboxylase. Now what is happening? Your DOPA is converted into non-epinephrine in the presence of vitamin C, hydrolase, hydra. The non-epinephrine is having no methyl group, is being converted into epinephrine, which is having methyl group. And what is that methylation basically called as? It is N-methylation. Who is providing this methyl group? Methyl group is being provided by SAM. Methyl group is being provided by SAM. Okay, methyl group is being provided by SAM. So all these things which we have already discussed in our regular classes, the same slide I have kept here. So now the question is very simple. So this is a condition called as phenylketonuria. Okay, so what is absent in phenylketonuria? This particular is enzyme absent, and there is lots of accumulation of phenylalanine. Okay, right? So this is phenylketonuria. So that is your PKU. So what is being absent? Either BH4 is absent or either phenylalanine hydrolase is absent, because this reaction helps in converting phenylalanine to thyroxine. So what are the things which get accumulated in the body? The things which get accumulated in the body can be phenyl acetate, phenyl lactate, phenyl pyruvate. Okay, what are the clinical features? IQ values will be little low, growth retardation will be there, seizures are very common, and we said the patient is going to have a fair skin. Why the patient is going to have a fair skin? Because this thyroxine is responsible for occurrence of for the production of melanin. Melanin in the body is not there, so the complexion cannot be maintained. The baby cannot be in dark in color regularly like her parents. Okay, so that is the reason why we have fair skin. You have mousy ordered body odor or urine. So what is treatment? Okay, there is phenylalanine being accumulated and the thyroxine is being reduced. So I'm going to do opposite. I'm going to reduce the phenylalanine and I'm going to increase the thyroxine. If there is any issue with the B4 supplements, I'm going to give BH4 supplements which are required for the baby. I hope this is very, very clear. I hope this is very, very clear. Right. So first question is done. I'm jumping into the question number 2. I want to be a little quick. Okay, right. So please try to cope up with the speed. So question number 2, a 45-year-old male with a history of chronic alcohol presented to the emergency department with a severe constant epigastric pain that radiates to back. This is a very, very important clinical sign, and reports nausea and vomiting, and he has tachycardia and abdominal tenderness is there. Serum have been noted with a milky appearance. Milky appearance is basically focusing on increasing in the triglycerides, which is as an etiology, chronic, because you see acute pancreatitis, the most common etiology is definitely alcohol, chronic alcoholism. Okay, along with increasing in the triglycerides. So the question is moving around acute pancreatitis, and whenever I'm talking about this particular condition, okay, I have two options here. One is talking about serum MLS, yes, right. Serum lipase is also right. But if you need to specifically pick an option among serum MLS and serum lipase, so lipase is going to be the best answer compared to that of the MLS. Okay, right. So enzymes and their diseases are very, very important, both from general medicine point of view as well as from our biochemistry point of view. And I have given a nice table covering all the important things, and which, right, say your MLS is very, very important when I'm talking about mumps. When I'm talking about mumps, MLS is important. Again, when I'm talking about pancreas, okay, your MLS is very, very important. Both MLS is important. But if I'm talking specifically, I am more inclined to lipase, and this is of course a question which is already given in the NEET examination couple of years back. Okay, right. Apart from this, I have discussed about SGOT. SGOT based questions are very common. You see in MI as well as in the liver diseases. CPKs are very, very commonly useful in identifying the early markers in the case of MI. LDH again in the heart attacks as well as in the liver diseases. Okay, and muscle dystrophy, muscle related stuff is basically associated with aldehydosis. Apart from this, serum alkaline phosphatases, acidic phosphatases. So all these are very, very important from the examination point of view. Okay, I hope you guys are done with this. Okay, so then comes question number 3, again moving around the same concept. Phenylalanin deficiency. Normal hydrolyze is there. We told you phenylalanin is converting into thyroxine in the presence of BH4 and in the presence of phenylalanine hydrolase. Now it is being clearly mentioned in this particular question that your hydrolase is normal. It is working normal and this is there, but this is reduced. So this is normal, this is normal, this is reduced. So the problem can be with BH4. So we have discussed about BH4 in the previous slides. The answer is option A. I'm moving ahead. Next comes, okay, before we go into this particular condition, the main things that are mentioned here are jaundice, vomiting is there, poor feeding is there, hypoglycemia is there, and increasing in galactose in the blood and urine. It is giving a hint that it is galactosuria. Okay, so now I'll be talking a little about the metabolism of galactose. So we know that the glucose in glycolysis in the presence of glucokinase or hexokinase. Here we regularly, if it is a glucose, we'll be getting glucokinase or hexokinase. Okay, so with the help of glucokinase or hexokinase, it starts the reaction. Galactose, with the help of galactokinase, is going to give our first product that is called as galactose 1-phosphate. And galactose 1-phosphate in the presence of galactose 1-phosphate uridyl transferase, it is going to give you glucose 1-phosphate. Okay, glucose 1-phosphate. So this enzyme is called as rate limiting enzyme. So every reaction rate limiting enzymes are the areas where most of your questions will be moving around. So you should be very, very clear about the rate limiting enzyme. So then there is phosphoglucomutase, by which our glucose 6-phosphate is coming out. And we know glucose 6-phosphate is a key enzyme for many of the reactions. Either it can form glucose, or either it goes to glycolysis, and it can go to different reactions. So my main concern is the rate limiting enzyme here is galactose 1-phosphate uridyl transferase. Whenever there is a deficiency of this, if it is not working, either galactose 1-phosphate or either galactose will get increased in the body. So sometimes what is going to happen, this galactose in the presence of aldolase reductase can be converted into galactol. So this get accumulated in the eye, and that is the reason why this baby have a corneal abnormality. That corneal abnormality is basically due to the accumulation of this product which is obtained from galactose. Okay, so that is very important. So whenever this is happening, the condition is called as galactosuria. What is happening? Mental retardation is there, conjunctival cataract is there. That is the reason why it get accumulated in the eye. So that is called as corneal defect. Jaundice will be there, hepatomegaly will be there. Okay, and the baby is going to have a kidney damage called as galactosuria, and this baby is not going to have glucose in it, so the condition is called as hypoglycemia, or it can be mentioned as neonatal hypoglycemia. Okay, so now it's very, very clear. The question is very simple. They're just asking the enzyme which could be mainly deficient in this particular condition. That is called as rate limiting enzyme of galactose metabolism. That is your option B. Yeah, we have 100 plus students, 101.15. Yeah, it's a good count. So I just need a thumbs up sign from all of you. Okay, so that we'll be proceeding, we'll be finishing it as quick as possible. Okay, right. Then comes question number 5. Now a 2-year baby is there with recurrent vomitings. Again, vomitings and all these things are very, very common. You have hyperammonemia. This ammonia get accumulated in the body, and this we have discussed a table when we are talking about the urea cycle, and whenever there is a deficiency of the first 2 enzymes in the urea cycle, you see this particular condition called as hyperammonemia. Type 1 is due to the first deficiency of the first enzyme, and type 2 is due to the deficiency of the second enzyme. So this is a concept which is inclined to urea cycle, and the blood test shows there is an elevated blood ammonia and there is lower blood urea nitrogen levels, and genetic testing reveals that there is a deficiency of an enzyme in the urea cycle that catalyzes the conversion. So they have clearly given it is converting one product to other product to form citrinuria. Okay, right, clearly given everything, and you guys are very, very perfect with urea cycle, top to bottom done along with the notes, right? So we know that this is urea cycle. I don't want to repeat this again because that's going to take so much of time. The main important key points in the urea cycle, it starts here that it starts in mitochondria. The first 2 reactions occurs in mitochondria, where your citrulline is going to come out. It's going to react with ornithine. Okay, and that is how the urea cycle is going to takes place, and the urea is going to come out. Okay, right, the urea is out. So first 2 reactions in this urea cycle takes place in your mitochondria. The leftover reactions takes place in the cytoplasm. That is main important thing. And of course, rate limiting enzyme is very, very important. So this reaction is called as the rate limiting enzyme. So that reaction is called. But in this particular question, they are not asking rate limiting enzyme. They have clearly mentioned what happens. Okay, so they have clearly mentioned carbonyl phosphate with ornithine in the presence of ornithine transcarbamylase, resulting in the formation of citrulline. Okay, so what is the enzyme they are asking? What enzyme? That is OTC. The enzyme is OTC. In this question, if they are telling hyperammonemia, asking you the rate limiting enzyme, then your answer should be option A. So both your rate limiting enzyme as well as your OTC are present in the case of your mitochondria. The rest other reactions are going to be present in the case of your cytoplasm. I told you the first enzyme. The first enzyme is rate limiting enzyme. Whenever there is a deficiency of this rate limiting enzyme, what happens? You will have hypoammonemia, the same condition whatever that is mentioned in the question, but it's going to be type 1 because it is enzyme 1 type 1. That's what we have discussed in the video. Enzyme 1, it is going to be type 1. Okay, that is enzyme 1 is nothing but called as CPS. Enzyme 2 is type 2. What is this enzyme 2? Enzyme 2 is your OTC. Enzyme 2 is your OTC. I hope you guys are very, very clear. I hope you guys are very, very clear. So I'm not going to go much deep into this. First two reactions or first two enzymes are basically associated with mitochondria, and the rest reactions are associated with the cytosol. That's what we have discussed about the urea cycle in proteins chapter. Now, which enzyme catalyzes the first committed step of fatty acid synthesis by carboxylation of acyl-CoA to M-CoA? Okay, right. So we need to have a clear-cut basic idea about the fatty acid synthesis, where it occurs, how it occurs, what are the enzymes, what are the basic things that are happening. That manipulation, everything are very, very important. So first we'll try to look into some basics here, and we'll try to look into the basic rate limiting enzyme which is happening in the fatty acid synthesis. And I want you to be very, very clear. Fatty acid synthesis takes place where and fatty acid oxidation takes place where is a very frequently asked question. So fatty acid synthesis takes place in cytosol, whereas fatty acid oxidation takes place in mitochondria. So this is the first thing that you guys have to make a note. Okay, so this is the first thing that you guys have to make a note. Just a second. Okay, right. So fatty acid synthesis takes place in cytosol and fatty acid oxidation takes place in mitochondria. Now my application based question is basically moving around fatty acid synthesis. So keywords about fatty acid synthesis that most of us are aware about the basics, right? What is happening glycolysis? So glycolysis end products are pyruvate in the presence of oxygen and lactate in the absence of oxygen. This lactate is being transferred to mitochondria for the Krebs cycle, and the intermediate reaction that occurs is going to provide you the basic component called as acetyl-CoA. Whenever your acetyl-CoA is there, you can see acetyl-CoA is there here. So whenever my acetyl-CoA is there, so if acetyl-CoA is having, if acetyl-CoA, the body is want energy, acetyl-CoA will enter into mitochondria. They undergo a process called as Krebs cycle, by which providing the energy for the body. If energy is not required by the body, so this is going to go and produce fatty acids in the case of your cytosol. So this acetyl-CoA move either to the mitochondria or move either to the cytosol basing upon the energy requirement of the body. That is what the concept we have discussed in the metabolism of carbohydrates. So if you just check out the basics, it is called as fatty acid synthesis. Sites where it occurs in different organs like liver, brain, kidney, lung, lactating mammary gland, adipose tissue. The organ where it occurs is cytosol, and the components which are required for this is NADPH, ATP are required, Mn+2 is required, biotin is required, and you require CO2, right? So the CO2 is provided by the bicarbonate ion. And this basically takes place in 3 steps. Step 1 is basically the transfer of acetyl-CoA from mitochondria to that of the cytosol, because this is happening like this. How it is happening? Acetyl-CoA is being entering into the Krebs cycle in the mitochondria. But now I don't want energy. I want to store my fatty acids. So what I am doing, I am sending it to the cytosol. I'm sending it to the cytosol where the fatty acid synthesis takes place. So first thing is this acetyl-CoA from mitochondria has to be sent to that of the cytoplasm. And in the cytoplasm, the most important thing is conversion of this A-CoA to M-CoA. So this A-CoA to M-CoA is basically associated with the rate-limiting enzyme. For every reaction, the most important question will be moving around the rate-limiting enzyme. Even in this question, the question is talking about the rate-limiting enzyme. So this is the rate-limiting enzyme they were talking about. And finally, the synthesis of fatty acid takes place. So there are three reactions. My acetyl-CoA is present in my mitochondria. Okay, if I want energy, I'll send it for the Krebs cycle, and the Krebs cycle is going to generate energy for me. Now I don't want energy, I want to store it, so I will be sending it to the cytosol, by which fatty acid synthesis takes place. So what happens? This acetyl-CoA is going to react with oxaloacetate, and it's going to form citrate. The citrate will enter from mitochondria into cytosol. So I got my citrate out. Citrate will go to and form oxaloacetate. Oxaloacetate will form malate. Malate will form pyruvate, and this pyruvate will come back to mitochondria. So the citrate form is being out here, and this citrate form is producing this acetyl-CoA back, and this acetyl-CoA is mainly responsible for the fatty acid synthesis. And please do make a note, a simple common sense is whenever the citrate levels are more, the cell is rich in energy. So now what I'm doing, I'm converting the rich citrate into ACOA. So ACOA is producing fatty acid for me. So the second step is conversion of ACA to MCA. This ACA to MCA is being mediated by a rate limiting enzyme called as acyl-CoA carboxylase. So this is the rate limiting step. So I have acetyl-CoA. We have discussed in mitochondria Krebs cycle. Acetyl-CoA is 2 carbon atom. So I am getting extra carbon from bicarbonate, which we have already discussed. So I have one more carbon atom. In the presence of ATP are also required. So in the presence, by a reaction called as carboxylase, I am getting M-CoA, that is a 3 carbon. M-CoA, that is a 3 carbon. So this is a rate limiting enzyme for fatty acid synthesis. Now I'm jumping into the question. So they are asking which enzyme by carboxylation is converting acetyl-CoA, A-CoA to M-CoA. The answer is carboxylase. Very simple, right? Use common sense, you will get the answer. So this is a rate limiting enzyme. Sixth question, the option is B. Guys, I want your quick response on the chat box. Okay. Question number 7 is talking about Krebs cycle. Krebs cycle we have nicely discussed with these notes. Okay. So the code for the Krebs cycle is citrate is Krebs cycle's starting substrate for making oxaloacetate. And I have discussed everything. I told you acyl-CoA will be there here also. It reacts with oxaloacetate, which is a 4 carbon atom, to form a 6 carbon atom. So this is 6 carbon atom. This is 6 carbon atom. So this is 6 carbon atom. So you have 3 6 carbon atoms which are acids. So that is the reason why it is called as tricarboxylic acid cycle. Three acids are produced. Okay, 6 carbon acids are produced. So that is the reason why the other name for Krebs cycle is tricarboxylic acid cycle. Okay, so I'm not going to talk much about this particular thing, but I'll be focusing main on important question which is being asked for us. Okay, sequence, the sequence code is citrate is Krebs cycle's starting substrate for making oxaloacetate. Okay, keeping that code in mind, now the question is what is the intermediate product that is being formed? Straight away you have citrate, isocitrate. Okay, citrate, isocitrate are the first products. They are talking about the first product. The options are very, very simple. Malate and all these are going to come at the end. Okay, the answer is option C for question number 7. All these are important, right? Inhibitors are important. Everything we have discussed. So I just kept here. Okay, now I'm jumping into the next question. The next question is a 6-year-old baby infant, 6 months old baby infant presented with a developmental delay, hypotonia, recurrent episodes of metabolic acidosis. Keyword I want you to remember is metabolic acidosis. Metabolic acidosis is nothing but lactic acid will get accumulated, we know, right? So whenever you have oxygen, pyruvate will get formed. Whenever you don't have oxygen, in the absence of oxygen, that leads to formation of lactate, that is nothing but called as lactic acid. So increasing in the lactate and elevated pyruvate levels in the blood are there. So genetic analysis shows there is a mutation that is affecting the enzyme that links the glycolysis to the Krebs cycle. So in the so many previous questions, I was talking about the communication where your acetyl-CoA is being produced, and that is basically mediated by a complex of enzymes called as pyruvate dehydrogenase complex. So this pyruvate dehydrogenase complex plays a very, very important role for this particular thing, which we have discussed so many times in our regular classes. Question number 9 is talking about BMI. Again, we have discussed about this. So they have given a 45-year-old woman came to the clinic for the routine checkup. Her weight was 160 centimeters and height was 160 centimeters. So it is 160 centimeters. If you are converting into meters, that is 1.6 meters. And her weight is around like 64 kgs. So now they're asking the BMI. So what we have discussed, the same slide we have discussed in the classes. So BMI is basically the measuring the obesity, and the formula for this is weight in kgs by height in meters square. So, and I have given the classification. Whenever the normal value is 18.5 to 24.9, whenever the value is more than 24.9, it is called as overweight or obese. Okay, right? Done. So now the question is 64 kgs were given, 1.6 in meters, 1.6 into 1.6, that turns around 25. The answer for this particular question is BMI index is 25 kgs per meter square. Simple here, the formula was given. The formula is here itself in the units. Whenever you have a problem based question, check out the units. Okay. So now they're telling kg you have to take. You have centimeters here. Centimeters has to be converted into meters, and it is meter square. So you have to multiply meter into meter. Convert centimeters into meters and divide it by kg by meter into meter. Simply, even if you don't know, if you have a basic knowledge on mathematics, this question can be easily solved. Okay, right? So they're talking about BMI. So you should know about the BMI. One. Second thing, you should know about the BMI normal values. And whenever the value is more than 24.9, the patient is considered as overweight. Okay, jumping into question number 10. 55-year-old male presented to the emergency ward with a chest pain. Lasts for about 2 hours. ECG shown no elevation segments. And the cardiac biomarkers, which are more sensitive and more specific. We have discussed lots about these biomarkers. So this is again my notes, which is already discussed to you. So enzymes and markers which are causing MI, I have discussed. Okay. So when I'm talking about enzymes, that is CPK comes into existence, followed by AST or SGOT, and followed by the last one is LDH, last for last. LDH is the last one. When I'm talking about the non-enzymatic markers or regular markers, the most important marker and most lovable marker, most important marker having sensitivity, specificity is troponin I. It is troponin I. So because reason is troponin I will come into existence after CPK, but the beauty of the troponin I, it lasts for 7 to 10 days. Even after few days, troponin I is going to give you the best result. Of course, myoglobin also have a role, but myoglobin is common for all the muscles, not only for the skeletal muscle. So it is not specific for MI, it is common for many other things. And the most sensitive and specific biomarker, the marker is going to be your troponin I, and enzymatic marker that is very useful is your CPK followed by SGOT followed by LDH, because LDH is the last one. This is what we have discussed. And now the question is very simple, which is more sensitive, which is more specific, is troponin I, option B. Then jumping into the next question, again the concept was discussed. Okay, so this is a previous PG NEET PG question, not NEET MDS, NEET PG question. The concept is given for NEET PG students. Okay, now the debate is whether to go with ALT or AST is the biggest thing here that you have to focus on. A 40-year male presented with jaundice, elevated liver enzymes. Laboratory investigation shows there is an elevation of both AST ALT as well as AST, but with a normal alkaline phosphatase. Which enzyme activity is associated with hepatocellular damage in this particular patient is the question. So if you check out my notes, like what I have discussed to you, so I have made you to write these notes. Okay, the ratio of AST as well as ALT are very, very important whenever you're planning to diagnose the liver diseases. Similarly, the ratio of LDH as well as, so this ratio is important for the liver disease. So whenever I'm talking about the heart diseases, the ratio of the lipid profile is important. Okay, so your low density lipoproteins followed by high density lipoproteins ratio is very, very important here. Whenever I'm talking about thyroid abnormalities, my thyroid stimulating hormone levels are very, very important in diagnosing. Okay, so for thyroid, it is the thyroid stimulating hormone. For heart, it is LDL by HDL levels, and for liver, it is AST by ALT levels. So whenever your AST and ALT levels are less than 1, that is called as hepatocellular damage. Whenever it is more than 1, there is a cirrhosis of the liver. Whenever it is more than 3, that is alcoholic cirrhosis of the liver or alcoholic liver diseases. And clearly mentioned in my notes when I'm taking classes, ALT compared to AST is more specific in liver failures, and that is what the question that is given. The answer is ALT. The answer is ALT. So straight away from the notes from the class. Okay, then PCR. So again, we need to learn little about PCR, very favorite area of questions when you're preparing for exams like INICET. Of course, need so many questions were given. So the question is, during PCR, which step involves heating DNA to a temperature range to separate two strands of DNA into a single strand? Okay, and we know that the DNA is a double helical structure which are bonded to each other by hydrogen bonds. They're telling that I'm heating, and by which I'm breaking these hydrogen bonds and converting a double stranded DNA to a single stranded DNA. The simple is, it is denaturation. Denaturation is a process by which I am heating the DNA to a particular temperature by breaking these hydrogen bonds and converting the double stranded DNA into a single stranded DNA. Simple, straightforward question. But I want you to make a note about few important things, add-on notes is for PCR reaction. So prerequisites for PCR reaction is a very frequently asked question. So what is the first one? The first one is the enzyme. There's TAQ polymerase, which is a heat stable DNA polymerase enzyme, and it is being obtained from Thermophilus aquaticus. And this is present in the hot springs. This bacteria is present in the hot springs, by which this enzyme is obtained from this particular bacteria, and that is very, very important prerequisite. The second one is DNTPS, that is called as deoxynucleotides. So these deoxynucleotides, they are mainly associated with blocking for the DNA synthesis. Okay, they blocks the DNA synthesis. Okay, and the next comes is the primer. Okay, primer are nothing but short oligonucleotides that franks the target sequence, that identify the target sequence. And the iron is very, very important because this is going to act as a cofactor. And of course, you need to have a basic DNA template and a nice buffering environment. So these are the prerequisites. And of course, this question was 2 or 3 times repeated till the date in INICET. Simple. Which of the following are prerequisites required for the polymer chain reaction? Now I want to talk a little about the temperatures in the PCR. So first is initial denaturation I'm going to do. So I'm going to use a temperature around like 95 degrees centigrade for about 3 minutes, and followed by denaturation going to happen. That is around like 90 to 96 or 96 to 98, around like 20 to 60 seconds. Then annealing takes place with a temperature, with a lesser temperature, that is 50 to 70 degrees centigrade, for around like 20 to 90 seconds. So these are the temperatures that you have to make out when you're preparing for the exam. Similarly, temperatures of your autoclave are very important, that most of us are aware. Autoclave temperatures are again a frequently asked question. The temperature of autoclave is, standard temperature is 121 degrees centigrade. You're going to hold it for 15 minutes. Holding time is 15 minutes. And the pressure what I'm going to use is 15 lbs. So this is normal basic temperature of autoclave. So whenever they're asking flash sterilization, I'm just trying to correlate the similar concepts of numbers in a different subject. Okay, so in micro. So whenever I'm going for a flash sterilization of autoclave, so my temperatures are 134 degrees centigrade. I am going to, my main motto is to decrease the time, right? So my main motto is to decrease the time. So by which I'm decreasing the time. So the time now I have decreased to 3 minutes. And I'm increasing the pressure also being increased to 13 lbs. So these are the numbers I want you to make a note when I'm talking about autoclave. When I'm talking about autoclave normal, standardized, autoclave, flash sterilization. Okay, so now the steps are important. I told you the initial step is going to be initial denaturation. Their complete denaturation is going to occur, then annealing occur in the presence of primer, then there will be extension, then there will be new strands of DNA that is being formed. Okay, so I want you to remember the steps. I want you to remember the prerequisites that are required for the progress of polymer chain reaction PCR. Okay, right, clear. I hope this is very, very clear. Guys, I want you to come to live, drag your cursor button to the live, drag it to one side. So you'll be coming live so that we can have a live interaction. Okay, so new students, please try to drop your message on the chat box, and all the registered students who are attending it on YouTube live, make sure I want your attendance. I want your attendance. So make sure I want your attendance, because I should know how many of you are attending this class, because this is a live class. This is a class. This is an exam which is already done for you. Okay, so please do make a note of it. So next question is Km value. Km value that most of us are straightforward question. Km value. Km value is substrate concentration at half of the maximum velocity. Option B. I don't want to discuss much about this Km value. So as the substrate concentration increases, the velocity is going to increase. The velocity is going to increase, and this velocity will become constant over a period of time. Slowly it starts, increases over a period of time. It's going to become constant. That constant velocity is called as Vmax. The constant velocity. Now the question is, Km value is a substrate concentration at which it reaches half of the maximum velocity. So substrate concentration at half of the maximum velocity, already discussed in the class, given in the notes. Lower the Km value, more the affinity. Lower the Km value, more the affinity. Km value of a particular enzyme is a unique thing that is almost equal to thumbprint. Okay, so it is basically called as thumbprint of an enzyme, and Km value does not depends upon the concentration of enzyme. It depends upon the concentration of the substrate. It depends upon the concentration of the substrate. Okay, right, clear, done. Some straightforward questions. I don't want to go very deep because I have a timeline for this discussion. Most of us, I have a timeline. So questions which are out of box or questions which are new, because we have multiple paper setters, right? So it was prepared by a person who don't teach you. Okay, so I have taught you biochemistry, and the question paper was prepared by a different mentor. Okay, so whenever something which is coming out of box of my discussion, I'm trying to address more rather than repeating the same concepts and again. And I hope you can understand, guys who are following me, who are following me can understand where I'm stressing more. Okay, right. No issues, right? No issues, right? I think everything is clear, because it's a new platform. It's a new platform to have more reach to the students who require really the work of MDSCONQUER. So I have started this. So if you have any issues, please do let me know in our WhatsApp, in our personally on my WhatsApp, so that I'll try to do modifications, light, visibility, audio, everything. I hope everything is clear. Okay, I need a thumbs up, and thank you so much. Next, I going to the next question. I think inclined to oral path and oral medicine, general path. It's a common question. I cannot differentiate exclusively for biochemistry, but I don't know why the question has bounced back here. Then the next question is a 14-year-old tall boy, tall. I know only one thing related to tall boy, tall limbs. Yeah, we have discussed about this beauty that is called as subluxation lenses. We have discussed about the subluxation lenses. Okay, and decreasing in the vision, the syndrome is Marfan syndrome, and the defect is in fibrillin protein. That is option A, straightforward question. The next comes, a question which is slightly tricky, not discussed in the regular sessions, but it's important. Okay, the process by which ATP is generated from the energy stored in proton gradation across the mitochondria. Whenever you come with proton gradation across the mitochondria, that is basically called as chemical gradation. Okay, so the answer is option B. The answer is option B. Please do mark this question. So this concept was not covered in the regular classes and it came as a question. Option B. We have discussed a lot about substrate level phosphorylation that most of us are aware. Substrate level phosphorylation definition is synthesis of ATP by the direct transfer. Here there is a direct transfer of the phosphide group from the substrate to ADP. It's a direct transfer where here there is a concentration gradient, a chemical concentration gradient that is being happening. So these two statements A and B are very, very important. Now it is basically focusing on the concentration gradient. Then your answer should be option B. Okay, your answer should be option B. So please do make a note of this. Question number 16, I told biochemistry will be filled with lots of vitamins, and you have so many vitamin based questions, but I think most of the vitamin based questions are very, very easy. Ataxia, confusion, all these things in combination with alcohol we have discussed, that is called as Venix encephalopathy. Very good. It's called as Venix encephalopathy. Okay, right. Very good. And it is basically associated with anti-beriberi vitamin, anti-neurotic vitamin. That is nothing but called as the beauty vitamin called as thiamine. That's a beautiful vitamin we have learned. So most of our questions will be moving around the first vitamin, that is called as B1 thiamine vitamin. The next comes again, you have one more question, an indirect question in combination of vitamins to that of the vitamins to that of the enzymes. Now the question is 60-year-old men with a history of again alcoholism, poor dietary intake, fatigues are there, bleeding gums are there, multiple petechiae on the legs, poor wound healing. Okay, I got my vitamin that is in my mind. And I have normocytic normochromic anemia. Which of the following is most likely to be the diagnosis of this particular case? It's scurvy, the vitamin C deficiency. It's talking about inclining about vitamin C deficiency. But we have discussed like two vitamins which are associated with post-translational modification. One vitamin associated with post-translational modification of collagen, that is your vitamin C. The beauty is, okay, it is vitamin C. Vitamin C associated with post-translational modification of collagen. Similarly, we have learned one more post-translational vitamin, that is post-translational modifications of your clotting factors, that is 2, 7, 9, 10. It is basically associated with vitamin K. So two vitamins which are associated with post-translational modifications is one is C and one is K. This is a question which is already given for NEET PG. Okay, so which of the following vitamins are mainly associated with post-translational modifications in the body? The answer is vitamin C and vitamin K. Post-translational modification of collagen, your answer is vitamin C. Post-translational modification of clotting factors, your answer is vitamin K. Now, if you go very deep into the statement which is given, okay, is post-translational modifications of collagen, that is called as hydroxylation of proline and lysine, okay, by an enzyme called as proline hydroxylase, by an enzyme called as lysyl hydroxylase. So this is what the question that is given. The answer is option C. The answer is option C. Already discussed. I'm not very keen about whether you have marked it or not because this is already covered. So they're talking about the post-translational modifications of collagen, assuming that there is a vitamin C deficiency leading to scurvy. Next comes, which of the following organelles functions as a digestive system of the cell? We know digestive system of the cell is called, basically they are filled with lots of hydrolysis enzymes which helps in digesting of unnecessary things or foreign bodies. And indirectly linked to vitamin A, of course, we have discussed whenever you have more vitamin A, what happens? More retinols will be there. Already discussed in the class, more retinols will be there. Whenever you have more retinols, what is going to happen? More hydrolyse enzymes will be there. More hydrolyse enzymes are basically seen in the case of your lysosomes, and lysosomes will get damaged. Lysosome cell membranes will get damaged. So the answer is option D, lysosomes. The answer is option D, lysosomes. The answer is option D, lysosomes. Okay, next comes again catecholamine synthesis is important, right? So non-epinephrine means no methyl group is converted to epinephrine which is having a methyl group by a process called as methyl transferase, and who is providing this methyl transferase? SAM sham is providing this methyl transferase. And what is this methyl transferase? Is basically called as, this is called as N-methylation. This is basically called as N-methylation, which we have already covered in the first question. So you have so many questions on catecholamine synthesis. If you are not very clear about catecholamine synthesis, please do make sure you go back and learn catecholamine synthesis, which is very important for us. Guys, I need a thumbs up sign. I need a thumbs up sign because we are done with 19. We are done with 20 questions. Okay, right? So I need a thumbs up sign. We are done with the first 20. So talking about negative nitrogen balance, I told you, I discussed this nitrogen balance concept, positive nitrogen balance concept. Positive nitrogen balance concept is seen like nitrogen balance is nothing like how much amount of nitrogen you take, how much amount of nitrogen you leave. Whether you leave from urine, whether you leave from feces, whether you leave from sweat. If you take more than what you leave, that is called as positive. If you leave more than what you take, that is called as negative. And I told you to remember negative nitrogen balance or positive nitrogen balance. Examples are the questions which are asked. So positive nitrogen balance happens in all positive things. Pregnancy, positive nitrogen balance. Baby is growing, positive nitrogen balance. You are recovering from a fever, positive nitrogen balance. You are recovering from a surgery, positive nitrogen balance. Okay. Whereas negative nitrogen balance, you have a trauma, negative nitrogen balance. Malnutrition kit, negative nitrogen balance. Means all positive things will lead to positive nitrogen balance. All negative things will lead to negative nitrogen balance. This is a simple concept which we have already discussed. Now the question is, yes, it is negative nitrogen balance. Okay, they are correlating with the surgery. So what is negative nitrogen balance? Correlating with the surgery. Okay, the consent is, you know, negative nitrogen balance will happen during surgery. That is already covered in your, that is already covered nicely in your question. I know recovery of surgery. I am recovering from surgery. That is called as positive nitrogen balance. Okay, I am during the surgery, during the process of surgery, immediately after the surgery, immediately after the trauma, I'll be in the negative nitrogen balance. After recovery from the surgery, after the trauma, injury, healing process, I'll be in the positive nitrogen balance. This I know. But now the concern is they have correlated this concept to a concept in general surgery. So this is basically called as integrated question. People who has done with general surgery, people who has prepared this long back, of course you guys can answer. Okay, but it is basically a general surgery concept. I can tell that it is a general surgery question. Okay, answer is catabolic phase, but I'll try to explain whatever. So in surgery, of course this is also present as a video on the YouTube, which was done by me. So immediately during the surgery, or immediately during the injury, or during the surgery, so we are going to have a different phases. That different phases is, first we are going to have EBB phase. So most of the reactions in the EBB phase are basically reactions which are associated with the shock. And followed by EBB phase, I'm going to have the next phase called as flow phase. And flow phase is basically divided into first catabolism, that is during the injury. Okay, when the recovery, the last phase is going to be the anabolism. Okay, so now the question is negative nitrogen balance. Negative nitrogen balance is during the initial phase. Okay, that is your catabolism. If they're asking the recovery from the surgery with a positive nitrogen balance, then your answer is anabolism. Okay, I hope you guys are very clear with this particular concept of nitrogen balance is being linked to the phases of trauma, or phases after, phases during surgery, or phases during trauma, which is a general surgery concept which will be done in general surgery. I need a thumbs up sign, which we are done with 20 questions. Now the question number 21, which of the following is a water soluble vitamin? So water soluble vitamin, I told you to remember BCs are water soluble vitamins. Okay, so all your B vitamin complexes along with the vitamin C are going to come under water soluble, whereas rest of your vitamins, that is A, D, E, K, are fat soluble vitamins. The answer is option B. Answer is option B. Okay, I'm going a little, I hope my speed is okay. Can I go a little faster? Whenever straightforward questions are coming, I'll go a little faster. So I need your response on the chat box. Mineralization of your permanent teeth starts at the time of birth. Okay, so clearly mentioned in the eruption sequence tables and everything, okay, which was given as a notes to you, okay, which I asked you to work so hard on it. So straight away clearly mention whether it's maxilla or mandibular molars, okay, which are the first teeth to get mineralized, okay. So this mineralization is going to start at the time of birth. It's going to start at the time of birth. So question number 21, sorry, the question number 22, the answer is A. Next comes, yes, we have again discussed about this, right? So I clearly discussed about this, giving a nice diagram. I hope you remember. I have given a diagram like this. So I have given a diagram like this when I'm taking class. That is called as your Maltese tetrad maltases like a cross. It looks like a cross. Okay. So that is particularly seen in which type of disease? Which type of disease? This is, guys. So I told you to remember Fabry's. I told you to remember F plus Breeze. I told you to remember as dry. So Fabry's is fabric. Which color fabric I told you to remember? I told you to remember red color fabric, and that is the reason why I told you to remember. We see angiokeratomas. So that is called as fabric or fiber, which is red in color. And this fellow is not going to have decreasing in the sweat. And this fellow is going to have dry. Fabry's, I told you to remember, fiber plus dry. Fiber contains stains on it. That stains are called as red color stains. That is called as angiokeratomas. Okay. And dry, this fellow is not going to have any sweating. And I clearly mentioned this particular thing is seen in this individual. And that is what the diagram based, histology diagram based question that is given. The answer is option A. The answer is option A. And I told you there is one more parasitology in microbiology is going to show similar feature in their RBC. That is, you can remember it as baby. It looks like a baby, right? So this cross, this Maltese cross looks like a baby. Okay, so you can remember this. So please do add in your biochemistry notes. Again, the same concept is going to come in your microbiology. Fabry's is going to have this particular feature in RBC. Similarly, your babesiosis is also going to have this particular thing in your RBC, which will be done in your parasitology. Okay, guys, clear? So please, that is a very, very important thing I want you to make a note. Next, identify the age of the child. Again, the same question was given in NEET 2023. Okay, so I don't want to drag the things. Okay, here the answer is 3 years, and it is straightforward given in your notes. Okay, nicely given, right? So nicely given. All your deciduous teeth, all your mixed dentation, deciduous teeth, permanent teeth, and everything are given in your notes, in your worksheet. So please go back and please do check it. Okay, jumping into question number 25 after itching. Again, this is a NEET 2025 application based question was given. After itching cavity of a composite restoration, the cavity got contaminated with the hand piece oil. Now what I have to do, reach. Okay, so reach for 10 seconds and continue with composite filling. Normally itching time is 15 seconds. Okay, basic is whenever I'm reaching, I'm going to do it for 10 seconds. So both of these are very, very important from our operative dentistry point of view. So basically it's an integrated question. Okay, already a neat repeat, and I hope like most of you are solving repeats on one side to be par in the prep. So next question, yes, difficulty index. Again, difficulty index surgery question. Again, NEET 2023 repeated question. So they're talking about the difficulty index. They have given a conclusion, mandibular third molar impaction. And if you check out, they have clearly mentioned it's a mesoangular. It's a class 2 molar relationship. Ramus, I mean, in relationship to the ramus, it is a class 2. And the level by which the bone is covered is level B. So 3 things we got. One is mesoangular. Second one is class 2. And the next one is level B. And with which you need to come to the conclusion. So difficult index scoring is mesoangular is 1, level B is 2, class 2 is 2. So that is 1 plus 2 plus 2. The answer is 5 scoring. Very important table. So many times repeated in the last IN NEET examination also. They have given an OPG by which you have to differentiate. You should know what is mesoangular on OPG. You should know what is level B on OPG. You should know what is class 2 and OPG. This is covered in your OS. Straightforward, simple OS based question. If you're not done, please learn the concept to this level. If you're already done, you can use this as a revision code. So this is part A, which is bouncer, right? Which should not be given, but it was given. Okay, I don't know why it was given here, but it is solidly OS question, cannot be integrated to dental anatomy at any point of view. Okay, chalo, then I'm jumping into 27. Of course, I have discussed this. Penicillamine, I clearly mentioned, is an antidote that is useful for which of the following ion? It is useful for copper. And which part I have discussed this copper in your biochemistry class? I was talking about Wilson's disease. Wilson's disease is a very, very important concept, right? Which is covered in your general medicine part. Okay, so it's an integrated question. It's covered in general medicine. So Wilson's disease is also talking about the copper abnormality. So copper abnormality, copper over copper is there. So I need to remove that over copper from the body by using an antidote that is called as penicillamine. So it's a straightforward question repeated so many times in the examination. So this is what the table I have given nicely. Okay, right. So this is basically vitamin D, copper, more concerned about Wilson's disease. Of course, it has many other important indications, but I'm more concerned about Wilson's disease because Wilson's disease, paper setters love to give questions so many times repeated in the examination till the date. Okay. So guys, I need your response on the chat box. I want you to be active. You're active. I can be active because I can't see you. The only method where I can see your activeness is on the chat box. So please try to be active in the chat box here and there, okay, so that we can have nice live interactions in the next couple of months till the date of your NEET and INICET, so that everyone can get exposure to good round of questions, concepts which are important from examination point of view. So coming to the next question, I was talking about which of the following is used in recombinant DNA technology. So lots of questions were given on this DNA technologies in the Q bank, right? So these are completely slightly advanced concepts which are not covered in most of the basic MCQ books, but the students are going to do. And that is the reason why I clearly mentioned on the group to do this properly, which are given in the Q bank. And I'm talking more about restricted endonucleases. Okay, the answer is restricted endonuclease, straightforward. It's an easy question, but my main concern is this restricted endonucleases are going to break the chain at a specific site, and they lead to the formation of sticky or blunt ends. They lead to the formation of sticky and blunt ends, and these sticky and blunt ends are basically useful for the cloning. That is what talking about the recombinant DNA technology. So make sure, please try to do this PCRs, recombinant DNA technologies, and all these a little extra, because those are the latest advanced things that are regularly happening. What is multi-PCR? Okay, what is reverse transcriptase? And all these are very, very important according to me from the examination point of view, which are not covered in most of the standard and basic MCQ books, what most of the dental students are going to do. So make sure, please do this, very, very important for us from the examination point of view. Okay, now one more question I was discussing this particular concept Stratford. I see, I was looking into part B. Okay, part B of today's GT. I see like most of the questions, integrated questions, which I have discussed in biochemistry, I see 10 to 15 round of questions which I have discussed in biochemistry integrated, because I tried my best to teach biochemistry in the most integrated way in the live sessions and then in the regular smart videos. And I see 10 to 15 general medicine physio questions are also straight away coming from. Okay, you see, which of the following cutaneous malignancy does not metastasis through the lymphatics or through the blood? The answer is definitely basal cell carcinoma. Straightforward question. The answer is basal cell carcinoma, and my reason is I clearly mentioned basal cell carcinoma occurs due to UV radiations. That's an area where I was talking about vitamin D, and I try to correlate it to the basal cell carcinoma so that you'll remember it is easy. And whenever this is happening, I mentioned clearly it is called as rodent ulcer. The reason why it is called as rodent ulcer, it looks like a rat eaten. I clearly mentioned it is most commonly seen in the case of middle 1/3 of the face. And whenever I draw a line from the corner of the mouth to the tragus of the ear, this is most commonly seen on the upper part of this particular line where the tears are going to fall. So assuming this is an eye, tears are going to fall in this area. So this is called as middle 1/3 of the face. And this is called as tear carcinoma. Reason why it is called as tear carcinoma, because this carcinoma occurs most commonly in the areas where the tears are going to be there. And again, clearly I have mentioned this carcinoma is called as this carcinoma because normally it's a carcinoma. It's a carcinoma, okay, right? But people call it as benign carcinoma. It is called as benign tumors are different, carcinomas are different, but this is a benign carcinoma. The reason why it is called as benign carcinoma is most of your carcinomas, they spread either by blood or they spread either by lymph, and this is the only fellow who does not spread. They spreads by direct invasion, because benign carcinomas, benign tumors are going to spread by direct invasion. They expand directly. And similarly, basal cell carcinoma is a carcinoma which has a benign mode of spread, that is called as direct spread. So that is the reason why it is called as benign carcinoma, and that is what the answer is, option B. The next comes, of course, I have discussed, I have given the notes. I made you to read a particular table when I'm talking about this GAGs. Okay, so GAGs I have discussed a lot in my classes, and I have given so many questions on the Q bank. So again, a question on GAG. They're talking about a GAG which act as a shock absorber, and it is straight away from the notes. The answer is option D. The next comes the syndromic diagnosis techniques useful for infections like meningitis. And I hope you guys have done parallelly with biochemistry in this particular module. You guys have done a lots of general medicine. Of course, I hope you're not done with CNS, but there is a chapter called as meningitis, a video which is prepared by me, how to differentiate different types of meningitis, because meningitis are caused by different organisms. It is seen with TB, viral meningitis is seen, bacterial meningitis is different, TB meningitis is different, fungal meningitis is different. So you have lots of meningitis, because meningitis is caused by different organisms, and that type of diagnosis are called as syndromic diagnosis. So diseases like meningitis, which are originated from different organisms, different category of organisms, you need to go for the syndromic diagnosis technique. And this syndromic diagnosis technique is called as multiplex PCR technique. So this is called as multiplex PCR technique, because normal PCR wala is going to have only one type of template. Wherever, when I'm talking about multiplex PCR, it is going to have multiple templates, which helps in identifying the multiple organisms. So that is called a syndromic diagnosis technique, useful for infections like meningitis, which are caused by multiple organisms, can be diagnosed with the help of multi-PCR complex. I hope this is clear. Next comes, which of the following is required for the synthesis of substance that is used to maintain the biological clock or the normal circadian rhythms in the body? So this is basically maintained by melatonin. Again, we have done this. So melatonin is obtained from tryptophan. So tryptophan will gives rise to melatonin, serotonin, tonin. So tonins are produced from tryptophan. The answer is option A, discussed in your regular classes. Okay, I'm talking about regular classes in the sense either it is discussed in your offline live class, or either it is discussed in your, because question answer pattern is more in live classes, pro live mini, and offline live classes. So I have discussed most of this amino acids and the major products which are released by the amino acids, in which I have mentioned this. Again, the substance that carry fatty acids across the mitochondrial membrane. I told you to remember car. Car helps in transportation, right? So it is carnitine, option C, and is basically associated with vitamin C. That is also C, car. Car helps in transportation of mitochondrial membrane. Car helps in transportation in the mitochondrial membrane. I have discussed this question. Again, a question is not a new question. It's already a repeated question. Biological activity of tocopherols has been attributed in which of their action? So we have already discussed about antioxidants. Okay, lots about antioxidants, and tried my best to correlate antioxidants to that of your operative dentistry bleaching concept also. Now I'm not going to discuss that particular bleaching concept. which is given in NEET 2025 examination. Okay, right? So bleaching concept was given there. But when I'm talking about antioxidants, and we guys know about antioxidants because antioxidants helps in improving your skin health. Antioxidants are very commonly taken in your COVID. Okay, so we have a habit of taking more during COVID. We have a habit of taking vitamin C, that most of us are aware with a common sense that vitamin C is associated as an antioxidant. Okay, so what are the antioxidant vitamins is a very, very frequently asked question, which we have already discussed. These antioxidant vitamins are A, C, and E. A, C, and E. And the most potent antioxidant vitamin is E. And of course, COVID, we know it is vitamin C. A, C, E are antioxidants. Now the question is tocopherols. Tocopherols are nothing but they are basically called as vitamin. This is another name of vitamin E. Okay, other name of vitamin E. So they are focusing on antioxidant. The answer is A. 34. The answer is A. Coming to 35, eye signs. I told you eye signs, biotid spots. Beautiful, beautiful diagram. Biotid spots. We have discussed about WHO classification of the vitamin A deficiency also. So it is vitamin A deficiency, biotid spots. I'm done. So vitamin questions are looking slight easy. So the 35-year-old, chest pain radiating to the left shoulder. So that could be your MI pain. Okay. So right, so that is MI. So clearly mentioned in the MI, we have covered in the previous slides. That is, it starts with CPK and it ends with LDH. It starts with CPK and ends with LDH, and in the middle you will get this SGOT. The answer is option A, already covered in the class. Yes, you have a question like this in NEET 2025. Spina bifida. Spina bifida, top to bottom we have done in pedo. Okay, so spina bifida patients are more prone to surgeries and more prone to allergic reactions, and that is the reason why we regularly ask the spina bifida or this particular category of individual to come in the early morning appointments, because the allergic reactions or allergens in the dental lab or dental clinic will be very, very minimal. Morning appointments are regularly given for this particular patients who are having the CNS abnormalities. And this is basically a neural tube defect, and the neural tube defect is most commonly associated with folic acid. Folic acids are regularly given to mothers. Okay, if you have any of your sisters in the family, okay, who are pregnant, so the gynecologist is going to prescribe this folic acid medication during their pregnancy period. That is mainly due to prevent this neural tube defects, and one of the most common neural tube defect that is most commonly seen in the case of folic acid deficiency of a mother leading to the abnormality in the baby is spina bifida. Question on spina bifida was given in NEET 2025. Then comes DHA. DHA, again, one more pregnancy based. Okay, essential fatty acids present in the breast milk, which are required for the normal growth, particularly the growth of the brain and the CNS, which are present in the breast milk. That is called as DHA. That is option C. Straightforward question. NEET 2025, guys. Straightforward NEET 2025 question was given. The condition, whatever that is seen, is basically due to the deficiency. This is a dermatitis which is seen on the neck, and this is called as Casel's necklace, which is most commonly associated with pellagra, associated with niacin deficiency. That is your option B. Guys, clear? We are done with question number 40. I need your quick response on the chat box, and I feel like you're okay with my speed. If you're okay with my speed, I'll go with the similar pattern of discussions in the upcoming classes. If you are not okay with my speed, I'll try to go a little slow by decreasing the number of questions discussions in the allocated time for me in the live sessions. So I just need your response in the chat box or the comment box about the speed. Can I go with the same speed? Because I think like people who are watching as a recorded version, they can modify the speed, but people who are watching it live cannot modify the speed. So you should slightly get prepared for the class. Then we can discuss more content. Then the class will be more effective in understanding as well as in solving more number of concepts. Now 1 gram of carbohydrate provides, they're asking the calorific value. This also we have discussed. I have discussed two values. One is RQ value, that is called as respiratory coefficient value. Second one is I have discussed calorific values in the class, and I hope you have done it. So calorific value of carbohydrate is 4 grams, protein is 4 grams, fat is going to be more. That is the reason why whenever you want to burn fat, you're going to go for gym. Okay, right? So it requires more calories to burn 1 gram of fat, and alcohol is 7 grams. Okay, now the question is 1 gram of carbohydrate is going to provide you option B 4 kilocalories. Hypolipidermic agents, which are nothing but agents which are decreasing the cholesterols, and we know the best agents which are going to decrease the cholesterols, which we'll be discussing in the next couple of days, that is your statins. So they're asking about statins, and they're asking about the enzyme on which these statins are going to act. Enzymes on which these statins are going to act are the enzymes which are involved with cholesterol synthesis. I hope you guys have done cholesterol synthesis cycle. So in cholesterol synthesis, I have clearly mentioned the rate limiting enzyme is HMG coenzyme A reductase. This is the other name of this HMG coenzyme reductase, and I clearly told how to remember this cholesterol synthesis. I don't want cholesterol synthesis. So what I want reduction of the cholesterol synthesis. So simple it is, HMG coenzyme reductase is a rate limiting enzyme of cholesterol synthesis. Whenever someone is acting on this, inhibiting this, my cholesterols will drop down. So that's what our statins are doing. So hypolipidemic drugs, example is statins. Where statins are acting on the enzyme which is the rate limiting enzyme of cholesterol synthesis. What is the rate limiting enzyme of cholesterol synthesis? The rate limiting enzyme of cholesterol synthesis is HMG coenzyme A reductase, option C. Thumbs up, already done, given in your Q bank also. The next comes, of course, guys, I have discussed a lot about your lipoproteins, and I clearly told lipoproteins cannot travel, they cannot move very easily, okay, in the body. So what they do, lipids, whatever we take, they cannot travel in the body. So they take the help of their best friend called as protein. So this best friend and lipids together form a compound called as lipoproteins. Lipoproteins can easily move in the body. There are different types of lipoproteins. The less weight lipoproteins are called as chylomicrons. The second one is called as VLDL. The third one is called as LDL. The fourth one is called as HDL. We have discussed well, given in your notes. The smallest, weight-wise, the least is chylomicrons. You can remember chylomicrons, the word chylomicrons as chotu. C for C, chotu. Chotu means less weight. HDL is high density is clearly telling. So highest is HDL, less one is our chotu. So now the question is, when I take lipids in the body, I take a nice burger in the body. So lipids will move into my GIT and they get absorbed from the GIT to a different sources. So whatever I take in GIT, those are called as exogenous. Exogenous, whatever that are present in the body, inside the body, are endogenous. Endogenous are most commonly present in the liver. Exogenous will be absorbed in the intestine. They are absorbed in the intestine. So this is what we have discussed. So exogenous are basically associated with chylomicrons. Endogenous are basically associated with VLDL. Whereas your LDL and HDL are associated with cholesterols. These are associated with cholesterols. These are associated with triglycerides. The first two are associated with triglycerides, and the next two are associated with cholesterols. One is LDL. What LDL is doing? LDL is moving the cholesterols from the liver to other parts. And what HDL is doing? It is removing the cholesterols from other parts and sending to the liver, which is good for us. The last one is good. Removing from other parts and sending to the liver is good for us. So that job is being done by HDL. So that is the reason why HDL has a protective effect on the heart. So they can ask you which of the following is a bad cholesterol or a good cholesterol. Good cholesterol or protective effect on the heart is HDL. Clearly discussed in the video, in the classes, about different types of all of this. I hope you guys have marked the right answer. It's very easy. Protective to the heart, good cholesterol, the answer is HDL. Anti-protective to the heart, bad cholesterol, the answer is LDL. The answer is LDL. The trace mineral which has a role in wound healing, immune function, and sexual maturity, growth and development is zinc. Straightforward, old repeat. It is zinc. Again, how vitamins are important. Similarly, minerals are also important. Minerals I'll be covering in the next couple of days. I'll be giving you one more Q bank exclusively on minerals. So someone please remind me about this. Pallavi or Wasim or Abdul, whoever are there, please do remind me about this. I have one Q bank which is already prepared for minerals, which I'll be giving access in your general medicine, because I'll be talking a little about vitamins also in general medicine again, from general medicine point of view. Along with that, I'll be giving access to the Q bank, which I have prepared from Harrison. I have prepared a few questions from Harrison. I'll be giving it. Okay, so zinc is the answer here. But this zinc related minerals based question is an old repeat. Then comes non-reducing sugars. I have given a code called as MLR when I was taking the class. Okay, MLR is R for reducing sugars. So reducing sugars are your maltase, lactase, and G for galactose. Galactose is a monocarbohydrate reducing sugar, whereas MLR dicarbohydrate reducing sugar. M for maltose, L for lactose are reducing sugars. Now the question is non-reducing sugar. I know this is a reducing sugar M. I know this is a reducing sugar L. I know this is the reducing sugar G. So the answer is sucrose. Sucrose, trehalose are basically called as non-reducing sugars. Next comes, which of the following is a positive allosteric modulator of your PK, which is, what is this PK? PFK. PFK is nothing but called as rate limiting enzyme of glycolysis, or it is called as first committed step of glycolysis. The concept of rate limiting enzyme, first committed step are discussed in all the platforms, WhatsApp, offline, online, everywhere it is being discussed. So they're talking about PFK. I told you to remember PK. Pawan Kalyan, you can easily remember, Deputy CM of Andhra Pradesh. Okay, so plays a very, very important role in your glycolysis. Both first committed step as well as the rate limiting enzyme of glycolysis is going to be your PFK. So now I have given this particular notes which is being shared on your WhatsApp groups. Okay, I told you, right? So these are allosteric regulations which you have to make a note, very important notes, processed by an enzyme activity, and it is controlled through a molecule other than the enzyme active site. So PFK, I was talking about the rate limiting enzyme of glycolysis. It is inhibited by, activated by. It is inhibited by ATP, it is inhibited by citrate, or it is inhibited by increasing in the H plus ions or acid. That is basically talking about the pH. And is activated by AMP, ADP, and fructose 2,6 bisphosphate. This is most potent. So this is the most potent activator of your PFK in glycolysis is by fructose 2,6 bisphosphate. Similarly, we have similar things with our Krebs cycle also. Krebs cycle, the rate limiting enzyme, and rate limiting enzyme is being inhibited by ATP long chain fatty acids acetyl-CoA and activated by ADP. So that is what they have clearly given. This notes was clearly given, and the question is straightforward from this particular notes. That is question number 45. So question number 45. So they're asking the activator of this particular rate limiting enzyme. The most potent activator is going to be fructose 2,6 bisphosphate. Then comes patient with megaloblastic anemia and neuropsychotic symptoms. Investigation shows there is an elevation of your methylmalonic acid and homocystinuria. Homocystinuria, methylmalonic acid, that most of us are aware. It's a straightforward question. The answer is B12. But here the first keyword which is given is going to deviate you from B12. That is, megaloblastic anemia is basically associated with both B12 deficiency as well as folic acid deficiency. Anemia which is most commonly associated with B12 deficiency only is pernicious anemia. Whereas when I'm talking about megaloblastic anemia, it is a combination of folic acid as well as B12. But other parts, neuropsychotic symptoms or methyl malanoic acid elevation or homocysteine elevation are clearly telling this answer is vitamin B12, option B. So that is the reason why I always suggest students to solve more number of questions. More the more, more the more, more the more. Again, next one. In enzyme inhibition, I have two components. One is competitive inhibitor. Second one is non-competitive inhibitor. And I have clearly discussed the same table, which I have attached here. And in this, I told you after going through the concept, I told you to remember the Km values and Vmax values. In competitive inhibitor, the Km value increases in the presence of inhibitor. In the presence of inhibitor, what is happening to the Km value? The Km value is being increased. In the presence of inhibitor, the Km value is being increased. Okay, whereas the Vmax remains unchanged. Whereas whenever I'm talking about non-competitive inhibitor, it is unchanged in the presence of inhibitor, whereas the Vmax value decreases. Now the question they are asking is about the competitive inhibitor. Increasing in the Vmax, increasing in the Km and unchanged Vmax is the answer. Increasing in the Km and no change in the Vmax is for your competitive inhibitor. The answer is option B. Then next comes, yes, we have discussed again about the structural components. The structural component, I'm talking about structural, the functional unit of an enzyme is called as haloenzyme. Haloenzyme is going to contain two parts. One is protein part, second one is non-protein part. The protein part is called as apoenzyme. The non-protein part is called as coenzyme. And this protein part to the non-protein part is bonded together by a component called as prosthetic group. By a component called as prosthetic group. Okay, so prosthetic group binds protein part to the non-protein part. Now the question is, a researcher is studying an enzyme that requires a non-protein organic molecule for its activation, because your coenzymes are going to activate the enzyme. This organic molecule is tightly bonded to the enzyme by a prosthetic part. So protein part to the non-protein part is basically handled by a prosthetic group. The next comes 49. Again, I have given the similar concept of question in the case of your Q banks. I don't know how many are focusing more on the Q banks. Q banks are very, very important. Xeroderma pigmentosum, okay, I have clearly mentioned, is basically associated with UV lights. Whenever I'm exposing my skin to UV light, I told you DNA get denatured. So what happens? They damages the DNA. They denatures the DNA. So whenever my DNA get damaged, the damaged DNA will be available as thiamine dimers. Thiamine dimers will be there. So these thiamine dimers are going to cause DNA lesions or thiamine dimer lesions on the body. So these lesions which are formed on the body are nothing but called as xeroderma pigmentosa. And what happens over a period of time? Over a period of time, so these thiamine dimer lesions will get healed by a component called as NER. NER is going to help them to heal these things, remove these things. What is this NER? This NER is nothing but called as nucleotide excision repairs. So whatever DNA lesions, they are excised by this NER. NER is excision. Whenever there is a damage to this excision, that leads to the formation of this xeroderma pigmentosa. That can lead to carcinoma in the future. So now the problem is UV damage, but the damage is not being repaired by NER. So NER defect is there. Okay. So that leads to this XP. So the answer is option B. I hope you guys are very, very clear. Already a similar range of questions were given in the Q bank. I don't know people who are not solving Q bank. It's okay. No one is going to monitor your scores. Okay. No one is going to monitor your scores. Even if you don't want us to display your name on the rank list that we are posting monthly once, yeah, that is also possible. You can personally message Dr. Karan sir is there. You can message him to exclude my name. You can give the score, but do exclude my name. I don't want to show my name to my batchmates or friends. That is also okay. That is also possible in MDSCONQUER, which we will be doing for you. Okay, but make sure you try to give exams. You try to use the Q banks on time, because most of the questions in the final exam will be coming from the frequent areas, common areas. But if you do, you will get to know what are the common areas. Okay, right? So this particular question, the answer is option B. And which of the following lipoprotein is responsible for transferring dietary triglycerides? I told you dietary triglycerides are nothing but called as exogenous. I'm taking from GIT. Exogenous triglycerides, my answer is chylomicrons. Whenever I'm talking about endogenous triglycerides, my answer is VLDL. Okay, right? So that is option B. Okay, right? So guys, I need your quick response on the chat box. So I think it's already 1.5 hours done. So we are able to cover the first 50 questions. And I'm thinking of to continue this session tomorrow, sharp at 6 o'clock again. Okay. I just need your quick response in the chat box. I know that most of you are little hurry. So we have one of the very, very most exciting, important cricket match, India versus Pakistan in the next 20 minutes. So I know that we cannot cover the next 50 questions in 20 minutes. So I want to go a little slow. Okay. So I just need your response so that today we'll be closing the session with the 50 questions and tomorrow we'll meet sharp at 6 o'clock. All fine? All good? I need a thumbs up sign from all of you. Okay, right? Super good. So I can see the most active student in today's class is Pallavi, because the new software is going to give all the analysis. So the most active student in today's class is Pallavi. Hats off to you, Pallavi. Being a clinician, having a clinic, being a mother, having kids, with all the commitments and everything. Yes, I'm very, very happy for you. So one is Pallavi, and the second one, the most active student is Jessica. Again, wonderful. Jessica is also having similar commitments like Pallavi. Many things to manage at the home. And of course, my love, Kadar Basha, is the third active person. So congratulations, guys. 1, 2, 3. Hope we'll have a similar type of live interactive sessions in the next couple of months before you take your NEET and INICET. Okay. Signing off as of now, Dr. Srikanth from Team MDS Conquer, and make sure you try to follow the channel, subscribe the channel, keep your notification on, make sure your notification should be on so that whatever classes updates from now will be coming ahead. Okay, tomorrow if you have a class, the notification will be dropped 24 hours before itself. Only if you're on the notification, you get a notification on your YouTube app in your mobile. So make sure subscribe the channel and keep your bell notification on. See you. Bye.